All right, so let's start with female reproductive system. For nursing school, you don't need to try to make it harder than it needs to be. So you mainly need to know the name of each structure and pretty much what it does. So the ovaries are the big one for hormones and eggs, right? They produce the eggs and they also produce estrogen and progesterone. So when you hear ovaries, eggs and hormones, estrogen and progesterone. The fallopian tubes are pretty much like the pathway. So after ovulation, the eggs move from the ovary into the fallopian tube, and then the tubes help carry it towards the uterus. Okay, so then the uterus is the place where implantation and pregnancy happens. So if a fertilized egg implants, this is where the pregnancy develops. Now, the cervix is the lower opening of the uterus. Think of it like a doorway between the uterus and the vagina. Pretty much, it's just that. It's just a doorway. So, and the vagina, is the flexible canal that connects the cervix and the outside of the body. So the simple pathway is the ovaries release, the tubes carry, and then the uterus prepares for pregnancy. If you remember that you already have the foundation for the rest of this topic. Now, let's talk about the uterus layer and the menstrual cycle. First, the uterus has three main layers. The inner layer is the endometrium. This is the lining that thickens during the cycle and is shed during menstruation. For the test question, when they ask, oh, what is the inner layer of the uterus? The answer, endometrium. The middle layer is myometrium. Myo means muscle, so this is just smooth muscle layer of the uterus. No, the women does not shedding this during the menstruation. Again, menstruation, endometrium. Now, myometrium will be muscle, just the muscle layer. The outer layer is the serosa, which is the outer covering. It's just pretty much a covering. Now, for the menstrual cycle, keep the pattern simple. Follicular phase, ovulation, and luteal phase. The follicular phase starts at the first day of menstruation and goes up to ovulation. During this phase, FSH helps follicle mature in the ovary. Estrogen will be rising and the endometrium starts to thicken. The middle cycle, estrogen peaks and triggers something called luteinized hormone, LH. Okay, so that luteinized hormone, LH, surge and is what causes ovulation, meaning the egg is released. After ovulation, we enter the luteal phase. So the empty follicle becomes the corpus luteum, and the corpus luteum will be producing progesterone. Progesterone is helping maintain the uterine lining. Okay, so if pregnancy does not happen, progesterone, of course, doesn't need to protect anything, so progesterone drops, the lining sheds, and menstruation starts all over again. Now, so remember, FSH grows the follicle, okay? LH releases the egg, estrogen builds the lining, and progesterone maintains the lining. So in case of pregnancy, progesterone getting pregnant, pregnancy, pro is like PP, kind of the same. Okay, so progesterone maintains the lining is the hormone for pregnancy. Now, let's move to the male reproductive system. Again, you don't need to memorize this like a random list. So try to more to understand it and try to just remember the most important terms. So sperm are made in the testes. The testes also produce, just think testes produce testosterone. After sperm are made, they move to the epididymis. So this is where sperm matures. It's not created here, it just matures, and this is where it's stored. So if the exam asks where sperm matures, epididymis. Okay? During ejaculation, the sperm moves into the vas deferens. The vas deferens is like the tube that transports sperm upwards towards the ejaculatory duct. So the seminal vesicles will be adding fluid to the sperm. These fluids makes the semen. Okay, semen is the sperm plus the fluid. So The ejaculatory duct passes through the prostate gland. The prostate adds alkaline fluids to the semen, which help protect semen from an acidic environment, like, yes, like the women have uterus. So the semen moves into the urethra and exits through the penis. So the clean pathway is pretty much testis, epididymis, vas deferens, ejaculatory duct, and urethra. So for nursing school, just know the names and pretty much the function. That's pretty much usually what you need for testing. Now, this slide is the why do I care as a nurse slide. So the prostate surrounds the urethra. That details matters because when the prostate gets enlarged, like BPH, benign prostate hyperplasia, or prostate cancer, it can squeeze the urethra. So by logic, then, the patient can have urinary symptoms like the bladder is going to struggle to push urine through the urethra. So that is why patients with prostate enlargement may have difficulty starting to urinate. So weeks, like a weak stream, dibbling, issues with urinary frequency, urgency, or feeling like they cannot fully empty the bladder. Also remember that the male urethra does double duty. It carries the urine out of the body and it also carries semen out of the body during the ejaculation. So not at the same time, but it's the same tube for both actions. Okay. On the female side, you don't forget the hormone part, okay? The ovaries produce estrogen and progesterone. The corpus luteum produces progesterone during the luteal phase. So if you're looking for the NCLEX pattern, it is this: prostate pressure equals urinary problems. Ovaries make estrogen and progesterone, and the corpus luteum is all about progesterone. Okay, so let's do a quick final review. For the female anatomy, remember the basic map: ovaries, fallopian tube, uterus, cervix, and vagina. Ovaries makes the eggs and hormones, fallopian tube moves the egg, the uterus prepares for implantation and pregnancy. The cervix is the opening to the uterus. The vagina connects the cervix and the outside of the body. So for the cycle, remember follicular, ovulation, luteal, FOL, follicular, ovulation, and luteal. FSH helps the follicle grows. Just remember F, FSH, follicle. Estrogen builds the endometrium, EE, estrogen endometrium. LH triggers ovulation. Progesterone maintains the endometrium after ovulation. Progesterone is the pregnancy hormone, PP. If there is no pregnancy, progesterone drops and menstruation begins. For the male pathway, keep it simple: testis, epididymis, to vas deferens, to ejaculatory duct, to urethra. So testis makes sperm and testosterone. Epididymis makes and stores sperm. Vas deferens transports the sperm. Seminal vesicles and prostate will be adding fluids, so you get what? Semen, and that semen is carried out through the urethra. Now, the three test style questions that you're probably gonna find, like this is really common. So, what is the inner layer of the uterus, of the one that is shed during menstruation? Oh, endometrium. Where does the sperm mature and get stored? Epididymis. What gland surround the urethra and adds alkaline fluid to the semen? Prostate gland. The same one that it gets BPH, but we get exactly. We have urinary issues. So this is the whole review. Know the names, know the functions, and connect to the anatomy, to the symptoms, like, and if you need, just rewatch the video and take notes, or if you can go to another video of the same topic, I don't mind. That's probably going to help you stick it better. Have a good one.